welcome back, and thank you, Ariane, for being here again. Please, can you tell us more about the fears that these women face today?
Bien sûr, ce qu'il faut comprendre, c'est que les peurs qui sont générées par la...
There is consistency in the fears that women are experiencing caused by the combination of the pandemic and the emergency measures taken by governments. These new fears are layered on top of their traditional fears around pregnancy and birth and even exacerbate them. All of this is further aggravated by self-isolation and social distancing, where there is too much time for ruminating and overthinking. In such conditions, these fears are amplified and become extremely powerful. In both mother and the birth partner, there are feelings of loneliness, abandonment, helplessness, a loss of control. This is where they start thinking, I won't be able to do it. I'm not capable of getting through it by myself. I can't do it like this. These are deep feelings of insecurity, fear of all the unknowns, and even fear of dying. And this particular fear of dying is reinforced by sensationalist news headlines that focus on sickness and growing death rates. Then there are the fears for their baby. Fear of how the baby will be affected by this situation, by the drastic changes in birth plans, by the negative emotions felt by the mother that she recognizes that she's feeling, and the fact that they feel ill-prepared because they might not have had time to finish antenatal classes. There is finally a very primal maternal fear. The mother can feel that she will miss out on her own labor and birth as it won't be the way that she planned it. Now, these are not all of the reported fears. There are obviously many more, and all the traditional fears on top of that. But these are the most frequent ones that are emerging now that we must focus on and address immediately. It's very important to see how all of this is happening within a context of overpressure. It is essential to recognize this type of context because situations where there is overpressure will lead to the appearance of overwhelm and depressions too.
Si on veut aller au plus important, c'est ça. Voilà.